Forget frequently asked questions.
Common sense, common knowledge, or Google.
How about advice from a real genius? 95% of people in any profession are good enough to be qualified and licensed. 5%
go above and beyond.
They become very good at what they do, but only
0.1%
are real geniuses. Richard Jacobs has made it his life's mission to find them for you. He hunts down and interviews geniuses in every field: sleep science, cancer, stem cells, ketogenic diets, and more. Here come the geniuses. This is the Finding Genius Podcast
with Richard Jacobs.
Hello, this is Richard Jacobs with the Finding Genius Podcast. I have a returning guest, Ardy Arianpour. He's the CEO and co-founder of Seqster. The last time I think I mispronounced it, but the website is Seqster.com. It's Seqster. And Ardy he's a genomics executive and a serial entrepreneur in the biotech industry. And before Seqster, he launched several clinical and consumer-based genetic tests as a chief commercial officer of Pathway Genomics and SVP of Ambry Genetics, which ended up being acquired by Konica Minolta. But now he's working on a project called Seqster, and it has some relevance to the current coronavirus. So let's talk about that. So Ardy, thanks for coming back. How you doing?
Doing great. Happy quarantine to you. Hope you and your family are well, and great to be back. Thanks so much for your time.
Yeah, maybe there'll be a new holiday called Quarantismus or something that happens in March every year. We'll see, but hopefully not. But tell me about Seqster. What's the premise of the company for listeners that don't know?
Yeah, so with Seqster, simple story. It all started with just seeking health data. Seqster is a SaaS healthcare platform that really enables organizations to drive efficient healthcare via comprehensive collection of medical records, EHR data, combining your individual genomic profiles, DNA, genetic data, as well as adding your personal health device, wearable and fitness app data all in one place, and then allowing you to really share that data on your terms, creating a longitudinal health record.
Oh, nice. I know, let's say by the time you get to be, I don't know, I've even seen this with my family, but, once you're in your 40s or 50s, you've been to all kinds of doctors. You've been, in the medical system for, as long as you've been alive. And some of those offices have been closed down, and some of these records, some of those records, some you can't get. And like your whole health history is just kind of in your head. And I know I don't remember half of the things that happened. My wife has to remind me. So it would be nice if you had all your health data, at least going forward, in one database, so you can, choose to show it to a doctor if you wanted to, or at least have a better sense of what's happened with you and where you're at.
Yeah, absolutely. And, I think there's main industry pain points that lack timely access to health records we're seeing. And what we built with Seqster is just cutting edge interoperability technology that can take that clinical data that you're talking about, Richard, out of any EHR in moments, integrate this patient-centric, technology, and combine your EHR data with your DNA data and your wearable fitness data. So we built this scalable solution that's deployable to solve multiple pain points for pharma, payers, life insurers, providers, and consumer brands that are seeking health data. And no better time to talk about this than everyone being at home, staying at home, trying to save lives and being quarantined during COVID-19. For sure, when we started Seqster in January of 2016, when I founded the company, we never thought that a pandemic was going to happen where we would be so far along with, thousands of hospitals integrated within the platform.
Yeah, so just a quick definition. So EHR is electronic health records, for people listening. And when did that become prevalent? I mean, how long has it been since, if I go to a doctor, it's very likely that they have an EHR created with them?
Yeah, there's been a huge tailwind where records have been digitized in the past, I would say, 6 to 7 years or so. But in the last 2 to 3 years, it's been tremendous. And that's because there's been new standards such as FHIR, F-H-A-I-R, Fast Healthcare Interoperability Resources Standard, that has been more adopted by the health institutions, even though it's very limited. There are some, major healthcare institutions that have that standard integrated. But more importantly, there are, thousands of hospitals that aren't up to the standard. And no one ever built a platform where you can retrieve, harmonize, standardize, and share all of this information. So if we take you as an example, where you have, 6 different health systems as an example from, coast to coast, and where you went to college, and, where you had certain surgeries done, and whatever your personal conditions are as an example, you have this longitudinal health record, and then, you have maybe an Apple Watch, or you have an oximeter, or you have, a continuous glucose monitoring device like a Dexcom device or something.
Mm-hmm.
And all that data is being siloed. So we knew that data silos were a problem and a big pain point. What we didn't know was that Seqster was going to become law as of March 9th, basically, of 2020, when CMS ONC dropped the final rulings on interoperability rules, where payers and providers and other enterprises will actually have to pay a penalty in 2021 if they don't give access for patients to, have all their data in one place. And we couldn't predict that we were going to be in, COVID-19 global pandemic, where everyone is seeking health data, whether it's for telemedicine or, seeing if you're positive or negative on a COVID-19 diagnostic test, or whatever the situation is.
Yeah, one issue that worries me though is, like my doctor here locally is like, oh, we've got the tests, you could, get tested and all that. And I said, well, if I do, where's that data going to go? And he's like, oh, let me check. They said, oh, the local government requires that we report it. I said, well, no, thank you. I don't want to get tested, because who knows what they're going to do with that? Will they try to say, oh, you can't go out? Oh, you can't do this, you can't do that, so I don't know. The two sides of the coin perhaps are coming out. It's a little bit worrisome that, especially with COVID-19 stuff, the data may be available, but who else is going to use it and how?
Yeah, great point. And I think that hits on the privacy, right? And I think there's a certain cost to our safety now with giving away privacy to solve this COVID-19 issue that is ballooning, where, it's an invisible balloon, actually. I think that's the way I see it. And if we looked at it from, a baseball analogy, if there's 9 innings, I think we're, top of the second inning right now. And we got a long way to go, because there's so much that we don't know. However, I think if you empower people like you and I and others to truly access, control, and own that data themselves, and allow you to share that data on your terms, and not because, like, your doctor said, hey, I'll give you a test, but, we're going to report this to the government. I think there's a fine line there where you should be able to say, hey, I want the test, but I don't want it reported, or I want the test, but I want it reported, but it's got to be de-identified information, so that, yes, I want to help research, but I don't want my identity to be reported. And so there are ways to get around this if you use the right technology. The problem is most physicians like yours and most hospitals don't have this sort of technology, and they don't even know that it exists. So,
all right. So how does Seqster work? And, how does it protect someone's identity, if so? And, let's get into some of the details.
Yeah. So it's user controlled, right? And so we create a longitudinal health record across all data sources, from your electronic health records, from your lab results, from your genetic DNA profiles, from your wearable steps and sleeping data, and your home health and fitness data and medical devices that you connect. And a great analogy for it, and an inspiration actually for us at Seqster and myself and my team, was back in 2016, where, we admired how Mint.com brought finance information together from Wells Fargo, Bank of America, your student loans from Sallie Mae, let's say, and your credit cards from JP Morgan Chase. And you got to see your net worth, or, how much in debt you are in total. Well, we asked the question about, what about your net health? How come we don't have a dashboard to see, your net health. And as you get older, your longitudinal health record should grow, with you, as well as, if you're a caregiver taking care of, your mom or grandmother or father or whoever, it's very important to, have access to that data, especially if you're not living with them, number one, and you're across states or cities or boundaries. And so we believe that health data is medicine, and there couldn't be a more important time to use a platform like Seqster to make any company a digital health company without that company themselves or enterprise actually changing their business models. And what I mean by that is a perfect example is like Disney. Disney has to become in some way a digital health company without getting rid of, Mickey and Minnie Mouse, right, in Disneyland. And what I mean by that is if you're a Disney employee, you should have access to all your health information. Disney should be giving you the tools as an example. Coca-Cola should be doing the same, and not just, pharmaceutical companies or biotech companies that understand how important this is. But I think COVID-19 really brings, the health data conversation at home, since everyone's at home.
So you use Seqster, you get all your data or as much as you can in one place. And then obviously you want to commit to adding to it as much as possible. Having various health trackers on you would probably help, like, Oura Ring or, Fitbit or whatever it may be. How have you seen it used in a useful way? Who's used it? And, what are some maybe case studies where you've seen it really had a big impact on someone positively?
Yeah, so we have, many examples of that. A caregiver example is a clear one where, we've had, lots of folks within cancer settings, particularly that had diagnosis of a particular cancer. A caregiver, either the spouse or the kids, were taking care of mom or dad or the husband or wife, and they had 6 different health systems. One particular example, they had MD Anderson data, they had Stanford data, they had Marin County data, they had UCSD, Moores Cancer Institute data, Sutter Health data, and they were carrying binders of the husband's information and CDs and a thick binder that was traveling with them to their specialists in their primary care. And within one green button of Seqster, we were able to bring all that together so they can eliminate that burden and the binder. More importantly, because Seqster is built, in a way where it auto syncs with all of the data, any time that the patient would get care at any of the facilities or institutions, it would automatically update their longitudinal health record themselves. And it was a great way for not only the spouse and the caregiver to track the health of the loved one, but also share that data with various different specialists and oncologists, as an example, and also with just the medical community in general. At the same time, it saved them a lot of time and even money in, gathering all their medical records in one place. So that's just one, large use case that's very prominent within the caregiver and cancer communities. There's another one within pharma where, we launched the Seqster Research Portal, where we can accelerate not just the retention, but the engagement of being a patient engagement platform for clinical trials to make clinical trials more patient-centric. And we're really excited about the opportunities that are coming towards us in the clinical trial space.
Oh, how's this going to work in the clinical trial space? Is it, I guess, people that are looking for enrollment, the investigators will be able to query your database anonymously, and then when they pick certain people, the people will be notified, and then they can choose whether to participate?
Yeah, exactly. Pretty much. We built a researcher dashboard and then also a study subject dashboard, which is all powered by Seqster. Pharma white labels our platform, and then they can manage projects, subjects, and all of the health data in one place. And then, the participants in the study subjects can manage participation including what they consent to share to pharma. And that's really important. I think pharma is finally realizing that you have to involve the patient at the beginning, and you have to empower the patients in the trials and give them something above and beyond what you're giving them before, so that they have some kind of platform they can track and monitor their own and their family's health. And that's what Seqster enables.
How many, how do you get an estimate on how useful the data you have is? Do you look by number of people subscribed, or are you able to, again, query the database in an anonymous way so that you can see, okay, we have 3,000 people with this genetic mutation, so okay, that's great. Researchers may be interested in that. We have 4,000 with this condition, et cetera.
Yeah, I think the key thing there is the fact that, the data that we get is very comprehensive, right? We get retrospective data and prospective data. And so what I mean by that is we can go back in time. And so for individuals, families, as well as for enterprises where the patients consent and the clients and members consent to share that data, they're able to bring together as much data that has ever existed and has been digitally recorded on them. And it's all authenticated by the person themselves and shared. And, we can, with our business intelligence tools and analytics tools that we've built layered on top of the data collection and aggregation of Seqster that seeks out that health data per se, we can take a look at the patient in a 360 patient view. And that is very valuable, as well as look at, superimposing and matching, let's say, your clinical data with your fitness data, or your genetic data with your EMR data.
I would guess you're probably not allowed to offer conclusions, because it's maybe giving medical advice, but so is it going to be up to people doing clinical trials to make these associations and conclusions, or is there a way somehow that, let's say I upload all my data and your system sees that there's a certain, genetic mutation or a certain biomarker or something that could be problematic. Can you at least make a suggestion, hey, based on what you've uploaded recently this past week, you may want to speak to a doctor about X?
Yeah, so there's a fine line on playing doctor with data, right? And we are very careful on, what we can say and what we can't say. Number one, the platform itself is, you have to think of it as kind of like an Intel Inside. So if it's white labeled by a very large provider that gets it out to patients, and they want to, fill in some recommendations and take on those responsibilities, the platform becomes that provider's platform, or that pharmaceuticals enterprise's platform, or the payer's, platform. And they get to utilize their expertise and layer it on top of the collection of the data. But at Seqster ourselves, we don't really give any recommendations to the data that's flowing. And that's because, again, there's a fine line on what we can say and what we can't say. However, we do visualize the data, where when you visualize the data, we do set parameters on it being above range, normal range, or below range. And, we can give certain recommendations based off of, let's say, Life Simple 7 that's powered by the American Heart Association to control your cholesterol and your glucose and lose weight and things like that. So there are certain, sandboxes there that we can play in, and we can give, concise and to the point recommendations that make sense for a behavior change there. But mostly, it is about collection and aggregation of data and empowering the enterprise to do what they want to do with that as their next step.
So what's the near-term future for Seqster? Is it, getting more people to sign on? Is it, how do you quantify it for someone? Okay, sure, tell me about Seqster. All right, well, why should I do it? What benefit is it going to give me? How do you crystallize the possible benefits for someone enrolling in the platform?
Yeah. So again, since we're not, direct to consumer, we don't need to, sell anyone on, join the platform, even though we have that availability. But our business model is SaaS, software as a service, or more importantly, it's digital health as a service for enterprise. And so we're churning data into action and outcomes. And, if you fit in, one of the 5 verticals of whether you're pharma or a payer or life insurance or a provider or, consumer brand, and you're looking to bring digital health to masses for your business models and pain points, then that's where Seqster fits.
Okay, gotcha. Are there any new things coming over the next year or two that you can talk about that's going to be an upgrade to the platform or change?
Yeah, so I think it's timely to maybe touch up on, our recent COVID-19 response and our COVID-19 Compass that's trademarked by Seqster. The COVID-19 Compass symptom checker module is built into the Seqster interoperability platform. It's allowing healthcare enterprises today to track the health and well-being of research subjects who may have been exposed to COVID-19. We launched it on March 26th. So, our country got shut down, second week of March. And, right after that, we launched it. We started working on it actually end of January because when we saw what was happening in Wuhan and in China, we wanted to make something actually for the Chinese market, let alone we just never predicted that we would be where we are today, probably worse off than China now in the United States. But I think it's a great tool. It's based on CDC guidelines and best clinical practices. And it's nice to be able to pair in our interoperability platform at Seqster with our new COVID-19 Compass feature. And in the next year, I think the world is putting their attention on COVID-19. We shouldn't forget about all the other diseases such as cancer and rare disease and, various different autoimmune diseases and things like that, chronic illnesses, diabetes, cardiovascular disease. I could go on and on, right? But everyone is just focused on COVID-19. With Seqster, we're agnostic. And so I think you'll see how even in telemedicine, telehealth is growing. But one big pain point in telehealth right now is sharing data and wait times in getting a telehealth virtual care appointment set. And when you do, how do you actually share all of your health data with your physician? You're just filling out forms, and how are you actually even telling the truth? And how do you know what runs in your lineage? And there's just so much that can be done. So we're looking forward to obviously the next year. I think 2020 is a watershed moment on so many levels for health data.
Interesting. Do you? One quick question. Do you think it would be interesting or useful, or it might be too much data, but if you were able to record each telehealth session you've done with with a professional and maybe have a transcript of it or certain keywords pulled out or make it searchable? Or is that, I don't know, is that even on the radar? Is that useful, you think?
Oh, I'm sure that could be probably useful. But again, it's like, the patient has to consent to sharing that information, right? Who's taking the responsibility of recording that session? Is it the company? Is it the patient? And then how is that actually shared? It's definitely doable. There could be, a lot that we can learn from if those sessions are recorded. Another thing is who's got the time to actually spend time to go through, tens of thousands, if not hundreds of thousands of hours of that data. And that is very important data. You bring up a really good point.
You'd have to use, software and stuff to go through it. But I just wonder what you would discover. It can be used for all kinds of stuff, for compliance, for the medical facility or the doctor. It could be used, again, to find certain keywords. I don't know.
Absolutely. Sure. Yeah, I think there's definitely, multiple use cases there. Yeah, I couldn't agree with you more. And using technology to be able to transcribe that information and then, calling out certain things with maybe AI there, that could be something. I could see that.
Yeah.
Yeah.
Well, very good. So, Ardy, what's the best way for people to to learn more about Seqster and, if they're running a company, big or small, to find out about the enterprise solutions.
Yeah, sure. So if you're seeking health data, we'd love to hear from you. Go to Seqster.com, Seqster.com, and you can learn more there. You can also follow us at Seqster on Twitter or find us on our LinkedIn homepage searching Seqster. And thanks so much for your time. Always a pleasure speaking to you, and a pleasure and humble to be on your podcast again.
Yeah, no problem, Ardy.
You've been listening to the Finding Genius podcast with Richard Jacobs. If you like what you hear, be sure to review and subscribe to the Finding Genius podcast on iTunes or wherever you listen to podcasts. And want to be smarter than everybody else? Become a premium member at findinggeniuspodcast.com. This podcast is for information only. No advice of any kind is being given. Any action you take or don't take as a result of listening is your sole responsibility. Consult professionals when advice is needed.